is the Emergency Medical Minute.
The snakes are coming out of hibernation and are more prevalent. So summer snake bite season, most of your snake bites are going to occur between April and October. There's about 8,000 snake bites that are venomous every year that's been reported, and 99% of these venomous snake bites are in the pit viper family or the crotolid family. So that includes your rattlesnakes, which are prevalent here in Colorado, your copperheads, and your cottonmouth. So with rattlesnakes, these are the most likely venomous snake to become life-threatening or limb-threatening because the venom is more potent, and then it just has a higher risk of with the hematologic effects with the venom. In Colorado, there's more than 20 kinds of snakes here, but rattlesnakes are the only ones that produce venom. Last year we had 79 bites in the state of Colorado. This year there's already been reported 2. So snake bite is considered a progressive disorder if not treated. That's why we have to observe these patients when they come into the ED for a period of time, because it will potentially get worse as time goes on. So the venom has proteins and enzymes that produce 3 main effects. So it can cause local tissue inflammation, which can progress to necrosis, third spacing of fluids, endothelial damage, which can ultimately cause loss of limb, hematologic effects leading to coagulopathy, and then systemic effects, which would look like hypotension, acute renal failure, angioedema sometimes. And then some rattlesnake species also have a neurotoxin that will present with muscle fasciculations in the patient. So if your patient starts to have like twitching, then that may indicate some kind of neurotoxin venom. So when a patient comes in, if there is a clear snake bite, then you'll want to mark any swelling that occurs around the bite, and then every 30 minutes you will reevaluate to determine if there's progression of swelling. You want to immobilize and elevate the extremity, treat the pain, draw initial labs, update tetanus, and you do not want to use ice, tourniquets, or do any kind of like IND or anything like that. You want to be able to allow the venom to dissipate instead of keep it controlled in one part of the limb. Not all bites are going to be venomous though, so some snakes will have what's called a dry bite, where they'll, even if it's a venomous snake, they won't actually emit venom. So venomous bites are going to look, you'll see puncture wounds, bruising, you can see bleeding in other areas of the body because of the coagulopathy of the patient, hypotension, paresthesia, and then your abnormal labs. So if any of these are occurring, you're going to think more of venomous snakes and a venomous bite. We do have an antidote. It's called CroFab. It's this medication right here. It's specific to certain venoms that we use. So here it's specific to the western diamondback rattlesnake, eastern diamondback rattlesnake, Mojave rattlesnake, cottonmouth, and water moccasin. But essentially, if the bite is showing any kind of systemic symptoms or is progressing, the swelling and pain is progressing, then you're going to want to initially just treat with the CroFab. It's expensive, so your initial dose is going to be about 6 vials, and each vial is about $2,500. $2,500 is each vial. So, but you have 6 vials, so that can be potentially like a $15,000 initial dose. If they are in shock or have a really severe bite, then you can even initially treat with more vials, like 8 to 12 vials. So that might be where the $25,000 comes in. If after an hour the symptoms don't resolve or start to improve, you can repeat that dose. Or once symptoms are controlled, you can start a maintenance infusion. So this can potentially be very expensive, but also life-saving. The biggest thing to worry about is anaphylaxis. So the actual CroFab is derived from sheep plasma. So with that, you'd be worried about anaphylaxis. So starting it slow, the drip, making sure that they don't have any reactions at first. And after the first 10 minutes, if they don't produce any kind of anaphylactic reactions, then bumping up the infusion rate. That's all.
Anybody want to guess what demographic is most likely to get bit by a snake?
Athletes.
Drunk guys.
Yeah.
Intoxicated males between the ages of 18 and 35.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.